Dr. Patel, I would like to ask you about lumineers and veneers. You see, we see sometimes on television advertised lumineers, and somewhere along the line, I have found that many of us are confused of what is a lumineer. I mean, we kind of have an idea what a veneer is. It's a clip-on fingernail. I mean, a clip-on tooth nail. So what's the difference of a lumineer? What is this hype about it? And give us the difference and give us what what they're used for, both of them, veneers and lumineers.
Lumineers are exactly the same as veneers. The only difference between luminaires and veneers is somebody trademarked luminaires. Luminaires are done mainly for teeth where the teeth are not touched at all. So that means if you came in and you see my smile, all I do is take an impression, have the porcelain pieces, or like you said, the tooth pieces manufactured and slap them on. They work in certain instances. If you have very protruding teeth and you put luminaires on them, they are going to be more protruding. That means they're going to be even more prominent than they were before. So in those instances, you really have to reduce the tooth structure in order to place them behind so that the form is better. So when you are seeking luminaires, you want to be careful with what kind of result can be achieved. Both have a certain place in treating patients with awkward smiles or misplaced teeth or improving their smiles. If you have a perfect smile and you attach luminaires just to brighten your teeth, they're a really good thing to use because now you're not cutting your teeth at all. But if you have teeth that are crooked, that are placed in front of one another, and you are going to place luminaires, well, it's going to be awkward because it's not going to achieve the result. So a veneer, like you said, a veneer is a veneer. That means it's a piece of porcelain manufactured to look like a tooth attached to the tooth. A luminaire is also a piece of porcelain, but it's attached to the tooth without making any adjustment to the tooth. That's the biggest difference between luminaires and veneers.
I see. So basically, as the patients, we really shouldn't concern ourselves too much with lumineer or veneer, because when we go to a dentist and we say, oh, we would like to have this tooth straightened out, this is too yellow, blah, 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 or the tooth is too short, or whatever it may be, we want to have fixed, the dentist will decide whether he should or can put a lumineer or should or can put a veneer. And because in the end, for us, the patient, we wouldn't know the damn difference even if we looked at it.
No, no, it would be difficult to determine the differences between the two processes unless you are explained about it. So you should always ask, the dentist what kind of result they are going to achieve. So if you went in and you say to me, I want luminaires, I don't care, I want luminaires, then I'm going to make sure that I go ahead and create a model of the patient, attach luminaire type of material on that model, show it to the patient, and make sure that the patient knows the type of result I'm going to be able to achieve with that process. If the patient's happy, obviously I'm going to provide that result to them. But if I see that they would benefit better by me prepping some of their teeth, then I'm going to suggest something else. I'm still able to use luminaires if I cut the teeth down. There's nothing wrong with that. But luminaires came about by less invasive dentistry. That's how he came about with the concept. He's saying that we will not touch your teeth and we will make them look better.
Right.
So that's how
And
luminaires.
so obviously there is a time and point for a lumineer if everything else fits and the tooth doesn't have to be grinded down. But if the tooth is already in it super crooked or whatever, putting just a lumineer on it, well, the tooth is still going to be crooked. It may look better, but still crooked. And
so very thick.
And
very thick. Yeah, very thick.
Very deep.
Right.
So,
Yeah.
so I got that. So obviously, not obviously, but it makes it looking to me like if you have one tooth in front which you need fixed because it's chipped or because of it's brown, whatever, and it's only one tooth, chances are if you put a lumineer on it, no matter what, it will become bigger because you're not grinding anything down. No matter how thin the lumineer is, it's going to be a little bigger. So that tooth might now be awkward in there, maybe a little bit like a
Right.
rock on a beach.
It might be a little bit forward of where it needs to be
Mm.
if we don't have the room to put that material on.
At which point a veneer would again, because you just grind the tooth down as much as needed, then put it on and refit it. I got it. And
And right.
I got it. So tell me in general, doesn't matter now, we're off the topic of veneer lumineers, but just in general, veneers slash lumineers. So what are some really good reasons to use them? I heard about a thing called instant orthodontics. Veneers being that is instant orthodontics. Tell me a little bit about it.
Well, veneers are normally used to correct somebody that has crowding or misshapen teeth or a small tooth instead of their normal size tooth to correct the smile of a person. So if you have crooked teeth and they're not really very very crooked, they're just a little bit crooked, instead of going with orthodontics, which is going to take 2 years to correct or 18 months to correct, uh, this in 2 weeks you will have a straight smile. So that is the concept of short-term orthodontics or immediate gratification for the patient, where with the use of veneers you can straighten, brighten their smile, and do it very quickly and efficiently.
So it's
Luminaires
basic.
also to
Go ahead.
add to this, uh, veneers are now at least 30 years old, and it's a concept that started many years ago. They're used very often. They last and they look fantastic.
Mm,
So the
right.
process is really worth doing if that's what you want.
So basically, when a person wants instant orthodontics and wants veneers, lumineers, crowns, whatever it may take to just put, it's a matter of him making the decision of, is it important for me to get it right now versus I have no problem going this over 2 years. I have no problem wearing a few braces. Braces these days are very invisible if needed. And do I don't mind the invasiveness as much as maybe somebody else who minds it for some reason more. That combined with the dentist's, small recommendations in terms of invasiveness, in terms of this, it's a matter of a patient. Some people, obviously, they want things today, and some don't mind doing it over a small period of time. So the people have that choice. Is that what you say?
Mind, mind you, when you do orthodontics, you're not doing anything artificial to your teeth.
Right.
So if you're a patient who is conservative in nature, then you do want to go with the orthodontics.
Right.
And the concept of the veneers is for somebody that wants a quick result, is, for example, breaking out in an acting career, or is becoming a CEO, or is a marketing person who needs a better smile tomorrow. He can't wait 18 months. So that is how you decide for your own self what will work for you.
Right, right. Again, it's our body, and thanks God, we still have some right over our body. And if we combine that with the expert advice of the particular professionals, in this case a dentist, I think we can make intelligent choices. What fits us?
Yes. Yes.
Wonderful.